Good afternoon. My name is Jayde Renee Blanca from Group 1B, Section BSN 3B, and here today with me is Derek Neil Bitun, Alyssa Cabalhin, Renzy Capillo, and Raymond Sebastian Corteza. The title of our research study is Passions and Pursuits of Retired Filipino Nurses, Exploring Life Beyond the Nursing Profession.
Nursing combines art and science, balancing compassion and knowledge. With a dedication to human dignity and patient needs, as nurses retire, they shift from busy healthcare environments to personal pursuits. This study explores the experiences, financial readiness, and decisions of retired Filipino nurses, aiming to uncover their emotional challenges, personal growth, and healthcare views to better support their transition and well being.
Our chosen research design is qualitative, specifically using the phenomenological approach, and the data will be gathered through in-depth, semi-structured interviews.
The study selected 8 retired Filipino nurses, 4 from the Philippines and 4 from abroad, using purposive sampling for diversity. Criteria included age, gender, marital status, retirement origin, nursing education, and at least 20 years of experience. Qualitative profiles with AI-generated Filipino pseudonyms for anonymity were recorded. The participant pool was formed through diverse contexts to capture various perspectives, with full consent required for inclusion to ensure ethical adherence.
Our primary data collection tool was a two-part semi-structured interview guide. The first section covers demographic information, while the second explored retired nurses' lived experiences. Questions were validated through a questionnaire, evaluated for reliability by the College of Nursing's guidance counselor.
The first theme is the retirement transition of retired Filipino nurses, exploring their shift from active nursing to retirement. Subtheme 1A was the physical and mental health of retired nurses, which focused on maintaining the well being through social connections and addressing health concerns to fully enjoy retirement. Subtheme 1B was the leisure and pursuits of retired nurses. It was crucial in the retirement transition, providing enjoyment, purpose, and personal growth, helping them to adjust to lifestyle changes and cultivate social connections. Subtheme 1C was coping with changes during retirement. It was important for retired nurses involving acceptance, adaptation, to manage emotional challenges and find fulfillment in new opportunities and roles.
The second theme is retirement satisfaction of retired Filipino nurses. Subtheme 2A was where retired nurses commonly experience separation anxiety from their profession, and they struggle to adapt and redefine themselves outside of healthcare. Subtheme 2B was the availability of time for loved ones, and it positively influenced retirement satisfaction for retired nurses. Subtheme 2C discussed the feelings of unfulfilled potential in the career field, and it often lingered for retired nurses, specifically if they perceived they could have made greater contributions.
The third theme is the health and well-being of retired Filipino nurses. Subtheme 3A presented a significant challenges for mental well-being among retired Filipino nurses that required establishing new routines to maintain a sense of purpose. Subtheme 3B discussed the necessity of observing proper health management and adopting a healthy lifestyle during retirement. Subtheme 3C highlighted that social support networks and community engagements were crucial for promoting the health and well-being of retired Filipino nurses as they help combat feelings of isolation and loneliness.
The fourth theme identified is identity and self-concept. Subtheme 4A was where retired Filipino nurses often maintain their professional identity by staying involved in healthcare activities to remind them of the profession that they love. Subtheme 4B was the engagement in post-retirement employment among Filipino nurses. It was often driven by financial considerations, a strong sense of professional duty, and a desire to stay engaged and fulfilled. Subtheme 4C discussed the perception of aging among retired Filipino nurses. It was influenced by many viewing aging as a natural part of life, a time of wisdom and reflection, while also being aware of health challenges and taking proactive steps to maintain health and quality of life.
The fifth and final theme is leisure and activities. Subtheme 5A discussed how retirement gave the participants the opportunity to spend more time with their loved ones, which was a big help throughout their transition. Subtheme 5B discussed how the participants were able to pursue new activities that they once deemed interesting after retirement, such as gardening, entrepreneurship, and life in the academy. Lastly, subtheme 5C, on the other hand, some participants found retirement rather unfulfilling and therefore decided to pursue new paths that are still related to the profession, such as joining clubs and volunteering in medical missions.
Retirement transition involves adjusting to newfound leisure time, finding a balance between relaxation and meaningful activities, and coping with changes in physical and mental health. Retirement satisfaction is influenced by a range of factors, including feelings of separation anxiety from the profession, increased time spent with loved ones, and reflections of unfulfilled potential. Some participants verbalize that retirement is a joyous phase since they're able to focus on other aspects outside the profession, such as spending time with loved ones and finally doing that one hobby that piques their interest.
Recommendations from this study apply to several groups. Hospital administrators can improve workplace planning and retention strategies. Professional nurses should recognize their professional societal impact. Retiring nurses should balance personal life and financial well-being. Student nurses should emulate retired nurses who pursue knowledge after retirement. Family of retired nurses should value the contribution retired nurses have made to the well-being of others. Retired nurses should prioritize fulfillment in retirement. And finally, future researchers can use this study for comparative analysis and further exploration.